and welcome back to Empowering Patients, the channel that is dedicated to supporting you every step of the way in your healthcare journey. I'm Mattie, your guide to navigating the world of patient empowerment. If you are new to this channel, please take a moment to hit that subscribe button and also the notification bell so that you don't ever miss out on valuable insights and content in helping you make informed health decisions. As always, any links or resources mentioned in today's video can be found down in the comments box. Now let's jump into today's topic. Today we are addressing a crucial aspect of your healthcare journey, which is how to effectively communicate with your doctor. Today we are specifically addressing how to talk to your doctor regarding a shoulder injury or a shoulder surgery as part of our Shoulder Master series. Many people find it difficult to articulate their concerns and ask the right questions during an appointment with their doctor. Have no fear. Today we are here to help you along the way to make sure that you get the most out of your appointment with your doctor. Today we are going to go through a list of important questions to ask your doctor, as well as some tips for making sure that you are ready for that appointment, to make sure that you have all the information that you need to make an informed decision. Let's jump in. Before you even drive to the doctor's appointment, there are some things that you are going to want to have prepared before you even get into the car. Consider this your pre-flight checklist for doctor's appointments. Here are some things that you're going to want to have ready. One is a list of your past medical history. This sounds basic and very simple, but as soon as the doctor starts asking you which relatives have had which medical conditions, including your parents and grandparents, those things can be details that are easily forgotten. So having a list ready to go can be very helpful. Two is a summary of your symptoms, including a timeline. The doctor is going to want to know, where does your shoulder hurt? Which motions make your shoulder hurt? What does that pain feel like? Is it sharp? Is it achy? Is it throbbing? Is it shooting pain down your arm? Is it worse in the morning or is it at night? If your shoulder pain is related to an injury, he's also going to want to know, when did this injury occur and what happened when your shoulder started to hurt. The third thing that you're going to want to have with you is a list of your current medications. The doctor may prescribe a medication as a result of your visit, maybe a medication to get you through until a surgical procedure or the start of therapy. And you might want to know how that medication interacts with others that you are already taking. So having that list can be very helpful. The fourth thing that we want to have with you is your list of questions. Those are going to be described in detail in the next segment, but you want to make sure you have that list with you ready to go. Next, you are also going to want to make sure that you have a notebook so that you can take notes about the information that the doctor gives you during the visit so that we don't forget later. Next thing you may consider bringing with you is your support system. Feel free to bring a friend or a family member to be with you and support you during that appointment. And that person may also be willing to take notes for you during the visit as well so that you can concentrate on your conversation with your doctor. Next, consider bringing something to do. This sounds silly, but in the event that your doctor is running behind schedule, make sure you have something to keep your mind occupied, especially if you're someone who may be a little bit nervous about your appointment. You want to make sure your mind is occupied while you're waiting. So a book, an activity book, a newspaper, a game on your phone, some headphones to listen to an audiobook or some music to keep you occupied as you wait. The last thing that you want to make sure to bring with you is your planner. In the event that there is a follow-up event scheduled or a follow-up procedure, you want to have your planner with you so that you can make the appointment while you're there, so you don't have to wait on hold after your appointment and make that phone call from home. Now that we are ready for our appointment and we're ready to drive to the doctor's office, let's talk about some important questions to consider during your consultation. I've got my list of questions ready to go. So let's jump in. The first question you'll want to ask your doctor is, what treatment options are available to me? Treatment options may include medication, injections, therapy, surgery, or a combination of the four. So knowing which route your doctor is planning on taking is going to help shape the series of questions that you ask next. If your doctor is recommending a medication, questions you may want to ask are, first, what are the side effects of this medication? The side effects of the medication may have an impact on your daily routine, on your ability to work, drive, complete self-care tasks, so knowing the side effects can help you plan. Also, does this medication have conflicts with any of my current medications? That's why bringing that list of medications is important, to make sure that there are no conflicts between any that you may be taking. What is the medication schedule? How often should I take this medication? Should it be taken with food? Are there other things that I shouldn't be taking at the same time, to help integrate that schedule into your routine? And also, you'll want to know what are the next steps if this medication is not effective in helping me with my shoulder pain or my shoulder injury. If your doctor prescribes an injection, such as a cortisone injection or a steroid injection, here are some questions you may want to ask. How long before I notice any positive effects from this injection? That's a great question to ask. There may be a few day delay between the time you get that injection and when you start to feel better. So knowing what that expected time frame is can be incredibly helpful and reduce some anxiety of the process. Another question is, how often do I need to get repeat injections? Some of them are every 3 months, or there may be a time frame when you're allowed to get repeat injections if another is needed. And you'll notice a theme. What are the next steps if this shoulder injection is not effective? What would be the next plan? If your doctor prescribes therapy, here are some things to think about. You can ask the doctor what time frame he anticipates that you will need therapy for. How many days a week? For how many weeks? How many months? What might that therapy process look like, and what things might they be addressing in therapy? You can ask the doctor if he has a specific recommendation to either a specific clinic or a certain provider that he knows and that he trusts, or if you already have a therapy provider that you are accustomed to working with and that you trust, it's helpful to ask for a paper copy of your therapy order to bring with you so that you can take it to your provider. If therapy is not effective in assisting with your shoulder pain or your shoulder injury, what would be the next steps after that point? The rest of the questions that we have on our list will involve if your doctor recommends a shoulder surgery. Questions that you'll want to ask for a shoulder surgery include, what type of shoulder surgery is recommended for my injury? There may be different procedures or techniques that the surgeon may use, so knowing where he's thinking about allows you to do some research on your different options so that you can make an informed decision. Is there more than one surgical option? Different approaches can yield different results and different recovery times. So asking about the different approaches can also help shape your questions and your decision-making process. What are the potential benefits of this shoulder surgery? Knowing the expected outcomes can help guide your decision-making and your process, and also help you set realistic expectations for your shoulder rehab. Are there alternative treatment options or non-surgical options? It's important to explore all available options before you decide on having a shoulder surgery. Some of those options may be ones mentioned earlier, such as medications or injections or therapy. Make sure that you and your doctor are on the same page and what your expected outcome for recovery and the things that you want to regain the ability to do after your surgery. What would be the result or consequence if I decided not to have surgery? There are plenty of reasons why someone may decline to have a shoulder surgery, but before you make that decision, it would be helpful to know, is my injury going to get worse? Is there potential for future damage? Will things stay the same and I will stay how I am? Those kinds of questions can help guide your process. What are the potential risks or complications with this surgery? Knowing those potential risks can help you weigh the pros and cons before you make a decision. What is the success rate of this surgery? Some people think this question is a bit nosy, but it is perfectly acceptable to ask your surgeon, what is the rate of success? If I do this, what's the likelihood that I will regain full function of my shoulder before you make a decision to have surgery? What is the expected recovery time? This can help you plan for things like return to work or returning to a favorite activity or returning to community mobility. How long will I be in the hospital, or is this an outpatient procedure? Understanding whether you will have a hospital stay or an outpatient stay can help you in the planning process to know what things you need to do before you have your surgery. It can also have an impact on your recovery time and your rehab process. What kind of anesthesia will be used during surgery? Will it be general anesthesia? Will it be local anesthesia? This can help reduce some fears and some anxiety on the surgical process, knowing what type of anesthesia to expect during that surgery. What is the rehab process after surgery? Understanding those post-operative, the after surgery rehab process can also help you with planning and also help you feeling like you're making a fully informed decision. Am I expected to go to an inpatient rehab where I stay, or am I going to be discharged right back to home and either have home health therapy or travel to outpatient therapy to help with making those plans? Will I need physical or occupational therapy, and for how long? These goes back to the questions that we had earlier. Both physical and occupational therapy can be an integral part of your rehab process. So understanding what those expectations are before your surgery just helps with your planning. What is the long-term prognosis for my shoulder function after this surgery? It is very important to know, will I regain full function of my arm? Will I be able to raise my arm over my head? Will I be able to brush my hair? If the doctor tells you you might regain the ability to reach about halfway at 90 degrees, that may, have a factor on what decisions that you decide to make in your care. What is the likelihood of needing additional surgery in the future? This is a fantastic question, especially for those considering shoulder replacement or certain joint surgeries. What's the lifespan of this surgery? Is it going to last 10 years, 15 years, 30 years? So depending on your age, this may play an important part in deciding what you do with your care. Can I get a second opinion? Many people are afraid to ask this question, but don't be afraid to ask. You are entitled to be informed and empowered through your whole decision-making process. So going to seek a second opinion with a different provider who may have a different approach is perfectly acceptable. Does my insurance cover this procedure? This is key. You will want to know, does insurance cover that specific procedure? Does the hospital or facility that you are going to be getting your surgery at accept your insurance? Does the anesthesiologist accept your insurance? You want to make sure that you check your insurance benefits for this specific procedure, and also try to make sure that all providers who are involved in your care are in network so that you know what you can be expected to pay for a copay, a co-insurance, or towards your deductible to help inform your care. The biggest question I think on our list is, what restrictions or limitations will I have following my surgery? Restriction is a fancy word for things that you are not allowed to do after your surgery. This may include things like a range of motion restriction, meaning you are not allowed to move your shoulder past a certain amount or bend your elbow past a certain amount of degrees. They may be weight-bearing restrictions, which would mean no picking up any items that weigh more than a few pounds, or no using your arms to push yourself up from a chair because that is bearing weight through the joint. You may also be told that you need to wear a sling for a certain amount of time after surgery. So these are all questions that you will want to know specifically. What restrictions will I have? Some more specific questions on restrictions may relate to what your activities will look like at that level, such as, will I be able to drive with these restrictions? Will I be able to work with these restrictions? Or what accommodations might I need at work after surgery to make sure that I can continue to go to work? Also, will I be able to shower? Can my incision get wet? Depending on the type of procedure they are, if there's a large incision, they may tell you that it needs to be covered or this should not get wet in order to prevent infection. Those are helpful things to know. And also, will I need to wear a sling? And if I'm wearing a sling, how long will I need to wear that sling for? So that way, again, you can work through that planning afterward. This last question is specifically for people who have other medical conditions that impact their care, who have mobility limitations. So if you are someone who is using a cane, a walker, a wheelchair, it's important to ask your doctor, how will your mobility and your ability to be getting around be impacted by your shoulder surgery, especially if you have restrictions. So that way you can plan ahead for use of a different device or additional care services to help you to make sure that you can still get around and take care of yourself. Thank you so much for joining us on Empowering Patients. I hope you found our discussion today on techniques for communicating with your doctor insightful. If you have questions or topics that you would like to see on a future video, please feel free to list a comment below. Your feedback is crucial to helping us shape content that truly matters to you. For more information, please feel free to check out the other videos in our shoulder series to help guide you along your shoulder rehabilitation journey. If you haven't subscribed yet, now is the perfect time to hit that subscribe button and ring that notification bell to make sure that you stay updated with our content. Remember that knowledge is power, and here at Empowering Patients, we are dedicated to supporting you every step of the way on your healthcare journey. Thank you so much for joining us and being part of our Empowering Patients community. Until next time, my name is Mattie, and I am wishing you health, happiness, and empowerment. Take care, and we'll see you next time.